Hey y'all, welcome back to The Culture We Speak. Today's conversation digs into Black mental health among youth, in our professions, and throughout our communities. It's a topic that stays close to home for many of us, especially in times that call for rest, reflection, and recalibration. I invite you to lean in as we explore the challenges, insights, and resilience that define Black mental health today.
From the flavorful foods we eat to the rhythm of the beats we keep, our hair and clothes define what it means to be chic. For centuries, onlookers have been captivated by our mystique and every aspect of our being that makes us unique. This is The Culture We Speak.
Today, I'm thrilled to be joined by two incredible guests. And listen, the bios were very impressive and can be found in the show notes. All this Black excellence over here was trying to have me reading bios for 45 minutes and all of the accomplishments and accolades. I wasn't ready. So let me keep it brief. I'm joined today by Dr. Enyo Dzata, a pediatric nurse practitioner with a focus on childhood and adolescent mental health. Her work spans from clinical practice to doctoral research on supporting students in public schools, particularly Black and Brown students, and engaging families in ways that improve outcomes. Next, I have with me today Dr. Chad Lennon, who is a child and adolescent psychiatrist at Sheppard Pratt's Baltimore, Washington campus. He's board certified in neurology and psychiatry, and he's worked extensively with adolescents, received numerous awards, and contributes widely to research, publications, and community education on mental health in Black communities. Welcome to both of you.
Thank you.
So as you're aware, I primarily work in educational spaces, and a lot of the audience that I have on this particular podcast are either speech language pathologists or educators. So I want to kind of focus our initial discussion there. And I'd like to know, what are some things that you've seen in your work with youth that educators or speech language pathologists might not realize is tied to mental health?
I would just say, off the bat, that the students oftentimes are carrying more than we realize. And I just had one example that I thought of recently of a kid who is a middle schooler, history of ADHD, has some issues with impulsivity, and oftentimes that it cannot, it's not always tolerated or understood, even when people know the kid has ADHD. And that can often affect their interactions with people too, because they act before they think. And so their classmates may not always understand why they say or do what they do, right? And so we're talking about his progress, medication management, and he discloses that he oftentimes has to tell himself when he's getting bullied or when people aren't understanding him that they're just playing a joke on me or they're just joking. So he's doing a lot of work to try to stay in the moment, because he says if he doesn't, he's going to lash out or react in a way that will really get him in trouble. And to be honest with you, okay, Dee, I can break down at the drop of anything, but I don't typically do that in my office. And it kind of took me aback because I saw a side of him that I hadn't seen before. Not that he wasn't working hard, not that, we've had a lot of discussions, but that was such a real moment for me at how hard he has to flip the script. He has to lie to himself in order to stay in the moment, because other people don't really understand him as well as we could, right? And so that really just kind of hit me, and I got a little bit emotional because I was like, you are working so hard. And it kind of hit his dad too. So I would just say that there's more to the story sometimes than we realize. It's not just that they have a diagnosis and they need therapy or maybe medication, but there's a fuller picture there that sometimes we're not always seeing because we're kind of doing what we know to do.
And one of the things I always think about is one of my mentors' comments that there's two places that you have to deal with people who are different from you and you have no other choice. One of them is jail, and the other one is school. Like you can't like step out and like say, I'm not gonna do this. Yeah, you have to be a part of the experience and part of the atmosphere. And so I think it's important to keep in mind that school brings about its own stressors just in the environment alone. And, and that may be a hard thing for all teachers to fully understand as they're really kind of try to focus on the academics and what needs to be happening there. And so it's really important to keep that in mind that school brings its own issues.
Yeah.
Mhm.
But and sort of what's Enyo is saying, like the the diagnosis in terms of the name, it's only a piece of it. It's really how that diagnosis affects them. So the great example you mentioned of someone who's dealing with ADHD has to try to figure out how to be constantly present because ADHD brings the process of becoming easily distracted, impulsive, responding to its external stimuli instead of kind of what's going on in the moment. Same things happen who's someone who's gone through trauma. Same things happens with someone who's dealing with autism spectrum disorder of trying to have to kind of manage in the midst of the social experience. So it's not just the letters, it's not just the name, it's how the person has to manage those things in the midst of the social atmosphere that maybe the people of the school may not fully understand.
Yeah.
Yeah, I think those are great points, but then you also have to go back to these are children that we're talking about. So they're doing some things
Hmm.
that many adults don't have the capacity to do with
Hmm.
a lot of the training and learning and wisdom that they've gained over the course of their lives. And so these children are being forced to sort of find coping mechanisms that they have to handle and identify and then dole out
Hmm.
independently in
Yeah.
a lot of cases. So that just compounds it even more.
I would say there were a couple other things that I thought of too. Just that
Hmm.
students oftentimes are disconnecting also. So to your point, Dee, those coping mechanisms sometimes is to disconnect.
Hmm.
Hmm.
And that may be through media or other things that they're doing, like they're showing up. But I have some students too and patients who they are present, but I think because maybe they haven't gotten the support that they needed early on, either because people didn't want to accept the diagnosis or they didn't see it as an academic issue. They looked at it more as a behavioral issue.
Hmm.
Those kids now don't have the confidence to sometimes show up in the way that they know to show up because it's not accepted or it's looked at as you're not trying or they just or maybe academically they don't do that great, but then um teachers are seeing that they have the capability but they haven't been able to bridge the two. So then it's like maybe they're not performing to the standard or to the grade that they're supposed to be in. And that may be a reflection of the cognitive dissonance that they've had to kind of put up to just be there,
Hmm.
and be present, like we were talking about earlier, but they still don't know how to actually apply what they know in the way that they need to do the work.
Hmm.
Schools can be quite rigid, just given all of the stress that everyone's carrying and all the work that teachers are forced to do
Yeah.
within a very finite amount of time. And that adds to that rigidity, kind of adds to the and compounds the challenge that a lot of people are facing, adults and children in the educational space.
And not even to just dismiss, just to say like teachers have to do more. I mean, it's a lot of work
Hmm.
what they're doing,
Hmm.
and many parents will go give their send their kids to school saying, okay, this is the babysitter, the teacher's supposed to do all this stuff.
Yeah.
So it can be really hard to be both the educator and the constant observer and the
Yeah.
paper
The
completer
caregiver,
and the
Yes.
yes.
caregiver
Hmm.
and the note
Yeah.
taker and the medic all in one person. It can be very, very
Yeah.
hard. And what's required of teachers now versus what was required of teachers
Mm.
when
Hmm.
Hmm.
when I went to school, a totally different sort of
Right.
process.
Hmm.
So in the same times we're talking about things like things teachers and administrators can do more of. I still want to give the praise to them that of what they're doing,
Hmm.
and they may be also getting to the point of capacity of just like, okay,
So,
these are all the things I need to do, and I just can't.
yes.
Yeah.
So yeah, I also want to make that out to them as well.
I
That's
think.
part of the reason why I chose to work in the setting that I do.
Hmm.
Because working in a primary care setting, which I am working in, but it's in a school where I have access to teachers, where I have
Yep.
access to leadership, where I have access to the district nurses who can help facilitate, the support, whether it's a 504 or an IEP, or just like talking, being a liaison
Hmm.
is has really been rewarding for me because now it's not just on one person, but we have a system where we're all kind of contributing in support of the kid. So I like this model, and I wish it was a little bit more streamlined to really maximize everybody's strengths and skill set and experience. But obviously, that takes time, and there's bureaucracy and all the different systems to try to make it all
Yeah. And
connect.
it's hard to be able to, because I remember doing something similar to that in the midst of my training at Mount Sinai Elmhurst in New York City, Queens. They had part of our fellowship was to actually be a psychiatrist in the school system. And
Mhm.
it was great to, all the things you're saying, and it's great to be able to communicate with all the people in the school system. It also helps out the kid because they don't have to go as far to get connected to someone. It's right there in the school. And it allows a lot of just barriers to be less of a problem having it there in the school. So I appreciated that opportunity to do it. Unfortunately, as you said, the bureaucracy. So a lot of times, there's just not a lot of either funding or state ability to kind of organize that space so that they can have providers going directly into the school. But for those who have it, please support and be a part of it. It's great.
Yeah.
Mhm.
I'm thankful, and I'm hoping that people will see more of the benefit, of it. Obviously,
Hmm.
there's a cost benefit ratio, but I
Hmm.
think obviously the benefit outweighs the cost.
Yeah.
But everybody's kind of stretched these days.
That ties directly back to your doctoral research, correct? Enyo?
Yeah.
Some of that project. Can you talk a little bit more about how you've been working to address that disconnect between schools and mental health services
Yeah.
for kids?
Yeah. As we all know, the pandemic was very, very challenging in so many different ways,
Yeah.
especially for students in schools, and the stressors that came with online school and what worked best and parents trying to be teachers but also teachers trying to teach. It
Hmm.
was just a mess, right? But everybody was trying to make the best of it. And what led me to my going back to school was really having a student, Native American, took care of all the kids in the family. There was a lot of mental health issues, including ADHD, and the student who was supposed to graduate came in for a routine checkup, checking in with them. Hey, how is it? You graduated? And they said, actually, I didn't graduate. And I said, oh, what happened? And they said that when the pandemic hit, online school was a struggle. Their partner committed suicide. This
Hmm.
person already has depression, anxiety. They tried to do summer school, couldn't do that. And I was like, well, what do we need to do? Like, what do you need to do to graduate? And they're like, well, I was 1.5 credits short.
Mhm.
Oof.
1.5 credits, what?
Yeah.
Like, wait, what? And
Hmm.
so this is a family. I don't know how many people have graduated from high school. And I was livid. Like
Hmm.
I couldn't even fathom. Like, how did we not get this person across the finish line? Like,
Mm.
this is
Hmm.
what perpetuates the thing that we don't want to happen, right? And so that really made me start to think about, okay, this is a challenge in this time, in this pandemic. We can't, as providers, I was having a hard time connecting with staff anyways, because they're not in the building. And I just kept thinking, like, is there a way that we could have a system that communicated even if we're not in the same place or in the same building? And so my dream is to one day have more of a system where providers and educators don't have to necessarily always talk on the phone, but we're all part of the same system.
System.
Whether we actually work for the same company or organization or not, we can communicate our um, diagnoses, our recommendations, our thoughts on a situation when families come in and students come in. But then the project that I did was at an elementary school looking at, oftentimes it's, a clinician, we're in a stage now where it used to be we would tell the patient and the family, this is the diagnosis, this is what you need to do. This is the
Right.
diagnosis, this is what you need to do. But now we're trying to really share in the decision making as to, like, this is what I'm hearing, this is what I'm seeing, this is what the diagnosis is. These are the options. What best suits you where you are right now? And so that was what the project was, is kind of looking at what families feel like they need for support for their child in the school system. And
Mm.
in terms of communication, what does that look like? Is it face-to-face communication? Is it text messaging? Is it the newsletters that we send out every week? And obviously in the digital age and electronic, like people really respond to the text messages more so.
Right.
And so the project was really looking at when we are seeking out your input on something, what's the best way to connect with you? Is it in person? Is it by text? So that's what we were looking at. And we got a lot of response through text message response.
Hmm.
So,
Yeah.
it was a small sample size, so it wasn't huge, but it did kind of help reiterate, families are on the go, they're busy, and if they have to read something and go back to it versus it's on their phone and they can get it right there,
Right.
we were more successful with that.
Hmm.
Okay.
Interesting.
Chad, I want to go back to something you were talking about a moment ago,
Sure.
with the weight and things that teachers are forced to carry. Like we're seeing more students with crisis level needs, and then also simultaneously seeing more burned out educators and even speech therapists. Because you live with one,
Yeah, I
so, which
know.
is how we met, right? But so there's so much more that everyone is carrying. And I was wondering,
Yeah.
how do we hold space for or even safely navigate both realities? Because you don't want to give assignments to one to support the other when everyone's struggling. So how do we
Yeah,
do that?
I know that the pandemic just kind of brought everything even more so to light,
Mm-hmm.
for good and for bad, because it was such a dramatic shift, and everyone then had to understand what's going on the other side.
Mm-hmm.
So I think a lot more parents now have more respect for the teachers. A lot more teachers have respect for the parents, and
Mm-hmm.
kids could choose who they want to respect. Anyway,
Yeah.
so it makes everyone kind of have a better understanding of each other. And so to your question, I think in order to be able to start the process of decreasing the burnout and decreasing the risk of burnout, the first thing is really just communicating about it. Because
Mm-hmm.
if you act like it's not happening or you act like it doesn't happen, then that makes it even worse. I mean, they
Mm-hmm.
comment uh, burnout is sort of this concept that's about an occupational problem, so
Mm-hmm.
it's only in the midst of your job, when in reality, it, it's it starts in your job, but it moves everywhere. And now they've
Mm-hmm.
having conversations about it's not just occupational burnout or job burnout. It's not only physician burnout. There's a lot of concerns about
Yeah.
that, but now parental burnout, ADHD burnout, autism
Mm-hmm.
spectrum burnout. So we have a better understanding now that people can get really fried and really burnt out just trying to maintain everything at some form of equilibrium.
Mm-hmm.
And if you're not going to be willing to share about it and talk about it, then that makes it really hard. I would even encourage, not to say that you have to have these big every week seminars about it in the classroom, but just
Mm-hmm.
having the opportunity for the administration and teachers to just have a point in time to say, hey, I really just want to check on you, make sure you know what's going on, and not I understand not every administration is the same, and it may
Of
be
course.
hard to be able to create that space, but the first step has got to be communicating about it. The
Yeah.
second thing, not just from a top down, but also
Mm-hmm.
in between all the teachers, have spaces to be able to talk about it amongst themselves. There's a
Mm-hmm.
lot of concerns that as things have been moving forward in terms of how people treat their jobs. So, people don't stay in jobs for decades anymore. I remember my dad who worked at Kodak. You started there, you retired there, you got your gold watch, and it was
Yeah.
like, yes. Nowadays, people change jobs all the time, and
It's
each
me. I'm
job is,
people.
yeah. Each job is seen as like, you find the job that suits you. You don't stay there forever. So, you know, the job market is different in terms of expectations, and the job
Mm-hmm.
market is different in how people decide to stay. The important thing around that, though, is that there has to be some level of camaraderie around the people that you're working with, regardless of where you shift to. So, yes, there has to be a top-down process of the administration coming to the teachers and say, hey, kind of what's going on? How are things going for you? There also has to be a system amongst the peers to be able to feel their safety and the ability to fully communicate about what's going on Those are, I think, the two biggest things that'll help decrease burnout. And really, it comes down to communication and talking about it.
Yeah, it just makes me think about a little bit of the burden that we were talking about earlier that falls on the teachers who they get a little bit of training in some of the behavioral things and obviously the developmental delays that might show up in the classroom. And I don't know across the nation what it looks like. I know in Oregon there's a lot of like streamlining with special ed. Like some kids are in special ed the majority of the day, other kids are in the classroom for a certain
Mm,
period of time.
yeah,
And yeah, my kids go to a public school. They talk about with some of the behaviors, sometimes the room has to be cleared and they have to leave the classroom itself.
classroom.
And, like that's a normal thing for them, right? And I don't ever remember having that be something that came up. And I just can't imagine, like, as a teacher on a regular,
Mm,
having to deal with that, but also not necessarily feeling equipped. Like in my undergrad, human development, psychological services, my clinical internship was at Chicago Children's inpatient unit, and people are trained for this specialty.
right.
And we're expecting teachers who want to teach and also want to teach all different levels, but they're not trained, like they didn't go into it for this,
Hmm.
right? So I think that can sometimes be where the burnout is, like not fully being equipped to handle, like they're expected to do it and
Hmm.
they're capable in some ways, but I feel like there's just been kind of a burden shift that teachers may not be well equipped to carry out. Again, not that they're not capable, but the
Hmm.
support that's needed to have the teachers do that and to know that at one time, like this was a specialty in and of itself that people
Hmm.
just chose to do,
Right.
right?
Mhm.
And had, more support in is something to think about as well.
Mm.
Mhm.
In thinking about support, it's going to be important for teachers to not only feel supported within their school, but also outside of their school, and that means the parents. Having a
Yeah.
5-year-old now makes me think a little differently. My sister was a teacher, and of course, my wife was in the school system, and I'm going in thinking of it in terms of, okay, well, I understand what a teacher's supposed to be able to do because I've seen blah 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 blah, and I'm bringing my own kid into this environment thinking like, oh yeah, so teachers are going to do this XYZ, not realizing like, oh, it looks a little different as a parent.
Yeah,
And
it
That
and
part.
does.
yeah, and so you go, you have to be able to appreciate it on both sides. And again, I think that's what the pandemic did, was really put some parents in their place and think like, okay, we have these expectations of teachers, but is it as easy as we think it is? And so yeah, totally head
Not
shaking.
at all. Yeah, no, I was
And
like,
so
no.
You like that, Chad, because I feel like parents are not necessarily always accountable either when
Mhm.
I'm asking questions about
right.
what time do your kids go to bed. Cricket. They just look at me like, like they're ashamed, or not ashamed, but just like, we could do
Yeah,
better.
they don't answer. Yeah.
They don't answer. They're like, well, they're supposed to be in bed by 10. Okay, but what time do they go to bed?
Mhm.
Midnight, 1, 2. Why?
Mhm.
On their phone. I'm like, what is it with
But
the
how?
phone?
Yeah,
Yeah.
What
it's
is
an addiction,
it?
man. Those
It is
pings.
an
Mhm.
addiction. And it's just baffling to me too, though, that like this is a regular conversation. Why don't you take the phone away? Whose phone is it? Who's paying for the phone?
Mhm.
Right? Like, and believe you me, I struggle with it too. Because the
Mhm.
minute I let my kids say that they can play a game on their tablet, yeah, too.
Right.
Yeah,
Chad
totally.
not holding up too, man.
It's a challenge, right? And I realize with my kids, we are not watching anything in the morning before school. No, no, thank you. Because there
Mhm.
will be a tantrum trying to like, oh, why? I just find no, we're going to
Yep.
school. Like, this is your job right now. Like,
Yep.
you don't
Yeah.
have any other job. And so that's something that is kind of a struggle too, is like talking to families about who's in charge. What
Mm.
are some of the things that are really important to be disciplined in and to continue? Kids do not need a phone. It's a privilege to have one. Everybody feels like they
Mhm.
need it. It's not something that we need within reason. I appreciate what you said about how challenging it can be and seeing, parents understanding what teachers are really going through, but also like as a community, we need to support each other better too and
Yeah.
hold each other accountable a little bit, like you can't just not, and it happens, we know this, but a lot of parents also just kind of checked out. Like they are checked
Mhm.
out.
Yeah. I
Yeah.
mean, it's exhaust talking about burnout. Parental burnout's a thing too.
Mhm. Definitely.
It's really goes back to like just the community concept that I think we've probably
Mhm.
lost over decades. Like it really is about everyone being as much aware as you can, but also being compassionate and being communicative on all these sort of things in a totally full circle way.
Mhm.
I'm going to be transparent
Oh boy.
about another situation I had with a family who I've known
Mhm.
again for a long time.
Hmm.
Hold up. Is this my family you're trying to call out? No, I'm
Right.
playing. Go
Oh, no,
ahead. I'm messing
a
with
long
you.
time. No,
I worry about that introduction. We said I would be transparent. I
absolutely.
was like, oh no.
Well, because I know this isn't always what happens in a clinic room, but the younger one has some OCD tendencies and ADHD and had some behavior issues. And he's, I think, in second or third grade now.
Mhm.
The middle child, nobody really talked about. The older child, all the kids were fine until they weren't fine. And it started with
Mm.
the older one starting, with not being totally truthful, leaving the house, just getting into trouble, and now living with family in California just because of the discord that occurred. And
Wow.
this is biracial family, just for
Mhm.
context. And
Mhm.
then once she left, the middle child, who everything was fine, everything's not fine now.
Mm.
Everything
Oh,
that the older
wow.
child did, now the middle child
Little
is.
child does.
And please believe, we've been talking about counseling not just for the kids, but as a family. And I had to have a heart to heart, come to Jesus moment with mom. And I basically said, like, you are talking about how much you want to get counseling for the kid, for your children, especially the middle one. But when she asked for it, she's now not willing to do it because when she asked, there was no
Mhm.
follow through. And now mom wants to
Mm.
do it. And the kid's like, no, I asked you, why am I going to do something now that I told you I needed a couple of years ago?
Mm.
Okay. So there's
Mhm.
that component of just the
Yeah.
struggle of trying to make it work. And the parents are working 60 hours a week. They're like, where do we even fit this in?
Mhm.
But when I was talking to mom, I said, there's more to this than just the children need therapy. There's
Mhm.
obviously deeper seated things that are occurring that we need to figure out. And it's been a challenge because I think mom feels like a lot of the things fall on her and she wants dad involved,
Mm.
just getting everybody on the same page, but also just like this overall evasiveness. Like they come wanting help. And when you give the recommendations, it's like
Yeah, the
it's
follow through.
yeah, the follow
Mhm.
through. And I'm still trying to figure out like what's gonna be the best thing for you. Because it's
Yeah.
yes, I want to do it, but no, I can't because of this. Yes, I want to do it, but no, I can't because of this. And these are the families that, again, are already struggling. And,
Yep.
I'm trying to also think like, am I making it worse? Like when I worked in pediatric endocrinology and we'd be like, check your blood sugars every 2 hours and da 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 da. And then when I had gestational diabetes and I had to be on insulin and I
Yeah,
had
you're
the
like,
titers and everything, I was like, this is hard.
yeah.
It's easy to say, hard to do.
Hmm.
Yeah.
Hmm.
So, I'm kind of at a point too where am I doing what I need to do to support the family in the way that they need to be supported, And
Yeah.
the heart that I had with the mom was good. But I also said I'm very concerned
Mhm.
because of the patterns that I'm seeing. We also got spiritual,
Oh,
Yeah.
and this is
And
something that's kind of a newer thing. Well, it's not a new thing, me, Dee. But in terms
yeah,
of like
for the care. Mhm.
when you're convicted about something and you're seeing something and you're like, okay, God, but I don't know how they're going to receive that. You know,
hmm.
Yeah.
I went there with her because I know this family
Okay.
and she was able to receive it kind of in a different way, but like it's like little by little. It's going to be, I know it's going to be two steps forward, one step back, three steps forward, two, I don't know. It's going to be a little bit of a hit and miss, but I'm just going to try to continue to support in the way that I feel like they need. And sometimes it may be a little bit outside the box of what
Mhm.
you're supposed to do, but that's kind of where I'm at. If that's what's needed,
Yeah.
Mhm.
I'm kind of like you, and this is part of the reason, D, like I've had conversations with you about where do
Mhm.
I fit in? Like, I don't know if I'm going to be fitting in this system for very much longer because I need to do different work.
Mm.
Yeah, that's such a big piece of it in a lot of Black communities that spirituality is a big piece of it. Sometimes in a way that can be a hindrance to
Right.
getting actual care. So let me not
Totally. Totally.
get that wrong, but
Oh,
Mhm.
yes.
but I think it's also a big component of, that belief system is a big part of how people have tried to cope or tried to overcome or
Yeah.
and sometimes been able to overcome. And so can you guys talk a little bit about that? And I know that may not be something that fits directly into practice, given that organizations don't tend to endorse that. But what's your perspective on leaning on more of the spiritual aspect, especially when it comes to Black communities?
Hmm. The first thing I always remember, especially with mental health, is that the biggest part of it is you have to put things in terms of their culture.
Mm-hmm.
So I can't go in, let me think even bigger. I can't expect if I'm going to go see a therapist that automatically the white man therapist is going to fully understand my experience, right?
Boy, there's an episode right there. Go
Yeah.
ahead.
No, and we can have that conversation. Nor would I expect that another black man will fully understand my experience.
Mm-hmm. Mm-hmm.
So when we're looking at trying to be able to help someone, at least how I kind of think of it is I always come in with some level of curiosity about, okay, what do I need to understand about this person to
Yes.
be able to make whatever recommendations I'm going to make work.
Totally.
So if that means I have to talk about, I'm not religious myself, but I'm spiritual. So if I
Mm-hmm.
have to talk about some spiritual aspect that I could connect to in order to help them connect to what I'm doing, fine.
Mm-hmm.
I whatever will use whatever. I remember having a conversation with a very psychotic patient, and he was having all sorts of religious affiliation connections with what he was talking about, and I'm busting out anything I can think of to just say, hey, I just need you to take medication and follow directions. Thinking about
Mm-hmm.
anything I can think of just to get him to be in the space, and that's what
Mm-hmm.
we should be doing with all of our clients is like, okay, whatever thing you can connect to, I'm going
Mhm.
to bring that to you in order for us to be able to make sense on the journey of
Mm-hmm.
what is going to work for you. So, am I saying that I'm going to come in and be ready to read the Bible or the Quran or whatever and be able to list everything off for you in a religious or be able to say, okay, let me get my Republican friend to be able to talk to you because no,
Mm-hmm.
I'm just going to try to see whatever I could connect to help us to work together to be able to
Mm-hmm.
help you the most. And this goes back to what you were talking about, and you with this family who you really had to kind of have a come to
Mm-hmm.
Jesus moment in order to help them work forward. That's what could work for them because your religiosity, you understood their religiosity, and it
Mm-hmm.
works. And the biggest thing in trying to help people is making that connection. And secondly, it doesn't necessarily have to be a big step forward in order for a step to be made forward. So,
Mm-hmm.
yes, we would love everyone to go see a therapist, but maybe that's not the first step you go. Maybe it has to be like,
Mm-hmm.
okay, is there a trusted person in your life that you'd be willing to talk to?
Yeah.
Yeah.
So, if it's a kid, is that a
Mm-hmm.
coach? Is that a pastor at your church? Is that a really important teacher? Shoot, is that like a janitor at your school? Like
Mhm.
just have someone that you could connect to. That's your first step that you're going to be feeling comfortable to talk about what you're feeling to
Mm-hmm.
someone. And then once you get to the point where you're used to that, okay, let's go see if you can talk to
Explore
a
this.
professional a little bit more.
Mm-hmm.
What would be your thoughts around that? Because you've just spent this time feeling comfortable talking about your feelings to someone you
Yeah.
trust. Can we try to move that into someone who's a professional? A step forward doesn't have to be a big step. And whatever you can
Mm-hmm.
use to help make that connection, I think is important, whether it be based on whatever sphere, whatever things they believe in.
Yeah.
Yeah. That applies also to speech therapy. Like when I
Mhm.
connect with a new kid and I want to make sure the environment is comfortable for communication to go forth, for them to be able to make mistakes, for me to be in a space where I can address those mistakes, and we can talk about how we're communicating and what we're communicating. You have to find that place of connection, regardless
Yeah.
of who this person is. And it may have very little in common with you, but you have to be able to bridge those differences and say, oh, here are some things we could both be interested in, or we can both talk about
Hmm.
in order to create that safe space for them to come out of their shell a little bit and share. And I would imagine it's similar with the work you all are doing. it's such an important part of what we do, but I think in a lot of cases, particularly in my profession, speech pathology, we often lack the cultural humility to go in with that
Yeah.
interest and curiosity in learning about the other
Mm.
individual. And
Hallelujah. Thank you.
yeah, and what you said, Chad, about that is so important. Having that curiosity to
Yeah.
learn and to understand that it's valid. The experience, the values, the interests, the likes and dislikes, all of those things that the individual brings with them is valid. Like they're all
Mm.
valid.
Chad, that's what I said. Leading with curiosity is so important. And I don't know that sometimes you feel like you're supposed to be the boss in the room or you're supposed
Right.
to be the person, but sometimes it's not about that. In order to help somebody, you have to understand where they're coming from, right? So
Mhm.
I do really believe that leading with curiosity and not assuming behavior or whatever is going on is indicative of who you think the person is. Understanding different cultures, what is celebrated, getting to know the student, leading with their strengths,
Mm.
I think is really important because I think sometimes we can go in with this is the problem, this is what we need to do, da, da, da.
Right.
That's part of the reason why I decided to become a nurse practitioner because a lot of the medical model was at the time was figure out the diagnosis, fix it, figure out the diagnosis, fix it.
Yeah.
And I really, some of the models that I was looking at with the nurse practitioner programs was meet them where they're at,
Mm-hmm.
kind of maybe guide a little bit, right? Because we
Yeah.
do have knowledge and we've been trained in certain ways, and then get to and obviously now that I've been working for, a while, I realize like every provider is in a different place with what that looks like.
That's what I was gonna say. Yeah, everybody looks differently. And I would also say, not to cut you off because I want to hear the rest of you say, the other thing too is every different discipline
Yep.
does that differently.
Totally, totally. And I guess my mom was a midwife. She did, she was trained in Ghana, she did home birth. So it was just a different perspective that I
Mhm.
had on what care looked like. Yes, she had the skills and the expertise and the experience, but then this is like such a, yeah, spiritual, but also such an intimate
Yeah.
experience and it's like the family's experience. Like my mom is helping facilitate something, but it was their experience. And I
Hmm.
think as a provider, it's easy to get caught up in the Western way of doing things, right? Because that's what you're trained to do. And as whether you're an SLP or whatever, kind of clinical background you're coming from, can we be curious and kind of meet people where they are and help them have the best experience that they hope to have,
Yeah.
you know? Even today, okay, I used bribery today. This is bad. We shouldn't be using bribery
Not
at all.
necessarily. It's a reward system. It's not bribery.
Okay, so I was at my daughter's school
Hmm.
and there was a little mix up. We thought we had BSU this morning and we didn't find. So I got to talk
That's
to the
Black Student
teacher.
Union, by the way,
Yep.
because
Yes,
I'd
for those
I'd
people
be
who don't
like, "What
know.
girl?"
Oh, sorry, Black
No,
Student
you're
Union.
good.
And we didn't, so I got to talk to some teachers and principal, and there was a girl that usually is in our with us in Black Student Union, and I guess she's on a behavior plan. I didn't know that.
Mm,
I think she has a history of like some ADHD and they're trying to figure some things out. And so I was like, what
sure.
do you want to accomplish this school year? She's like, I don't know. I was like, what about, and I don't work for the school. Why am I going into like clinician mode? I don't need to be doing this. But like, I want her to have a good experience, you know?
Right.
I feel like success is her having a good experience and not being molded into who we think she needs to be. Because obviously, in order to learn, you kind of gotta you gotta be doing some of the things, listening, following instructions.
Hmm.
But like, I want her to have a good experience. And because when you have that, what I've seen is that your confidence is usually a little bit higher. You're a little bit more willing to go to school when you,
Yeah.
and so we were just talking, the principal and I were talking about like, can we shift it to her skills to be more leadership skills?
Hmm.
Maybe she needs to be put in leadership positions so that she can build that confidence up and see what she's capable of, versus the negative that she's kind of hearing because of her
Yeah.
behavior.
Mhm. So I want to shift it a little bit because I know we're kind of dancing around the topic, but haven't quite gotten there. So what are some of the biggest misconceptions about Black mental health? And I mean that from outside perspective and also from inside perspectives. What do you think are the misconceptions that Black folks and other folks are operating around?
Mm.
I'm gonna let you lead on
Let
that
me
one.
get some stares. I think y'all both just stared at me. Like,
It's okay. Just
Somebody's
bug-eyed.
got to do it.
Somebody's got to go first. I've had recently do some presentations on this actually. There's
Oh, okay.
the stigma comes from inside and outside.
Hmm.
And let me start with the one we probably all know is the one from outside. So I commented earlier about like the experience of, okay, if you're going to be connecting therapeutically to your therapist, it may be harder to be able to do that with the white man doctor versus me, the black male doctor. There's long history since we came over here on ships of the biases that just exist. I mean, there's biases around pain management with doctors of what they perceive as pain. There's biases on different sorts of diagnoses, including psychosis and ADHD, which you've mentioned a few times, versus ODD. There's biases in terms of what is perceived as a mental health problem versus just a behavior problem. And so these things do exist from the outside. And so that makes it really hard for a person going to see a provider to feel like they can feel safe and they can be open and they can have the ability to be honest with the provider, noting the biases. I mean, we don't have to sit here and lament over Jane Merriam Sims, I don't think, to understand
Right.
where the biases lie and the problems that come with that. So yes, it exists on the outside, and I don't want to sit here and minimize that and say that's nothing because it's a lot. We
Hmm.
do also have to keep in mind the biases that come within. There's
Hmm.
still a lot of, at least I can talk to about mental health. I imagine there's probably some with speech therapy too. The biases about mental health and the taboo around it.
Hmm.
What's wrong with this other person? They're just weird. It's a problem that they have. It doesn't have
Hmm.
anything to do with anything. They just need to hurry up and fix it, get themselves together. And so
Hmm.
the taboo around mental health and the bias about what it is exists from within.
Hmm.
Some people even think, oh, it's, you need to read your Bible, you need to get more connected religiously.
Yeah.
When we have tons and tons of evidence to show that there is some genetic markers, some biological underpinnings around all of
Hmm.
this around mental health. I would also say not only is there the level of the concerns about being taboo, but also just a general misunderstanding around it. We don't.
Yeah.
Uh, I I hate to say it like this, but Black people don't always talk about mental health stuff.
That
Mm-mm.
part. That part.
So, when we're dealing with something as simple as feeling sad, like
Hmm.
I think a lot about my father, rest in peace. Like
Hmm.
just me being a black man and him being a black man and having to deal with emotions are just different. I just
Hmm.
remember my dad would always have his points of anger, but I can understand now as an adult that probably some of those moments of anger weren't really anger. They were like sadness or anxiety or something else that was
Mhm,
going on.
mhm.
But as a black man, you can't really talk about that stuff.
Yeah.
You could talk
It's not
about
a lot of safe
anger,
spaces. Yeah,
right?
and there's not a lot of safe spaces to do that for whatever reason. But I'm
Right,
with you. The stigma makes it very hard.
yeah. And so you
But
have to
identifying that it's even in a like that there's
a
something
thing.
under, yeah, that it's a thing.
Right.
Yeah. And so I
Yeah.
say that only, because I can reference it as a black man, but I know it's in all
Hmm.
sorts of spaces with women of
Hmm.
color. There's issues around people of neurodivergence,
Hmm.
ADHD, autism. Having the space to be able to talk about these things is really, really hard. And feeling safe to be able to do that is really hard. And that's because that bias comes within. There's a lot more, and I feel like I'm just going to start talking randomly. I apologize. There's a
Go for
lot
it.
of research out there that shows how people with ADHD and autism do a lot of masking because they're so
Hmm.
concerned about other people noting their experience of the ADHD
Hmm.
or having autism and what that means and their difficulty with connecting with other people because of that. And so like I said, the taboo is from without and the taboo is from within. And it's really going to be important that there's a full-fledged understanding that the bias is not just out there and we have to be fully honest and open about talking about it.
I was just gonna say from personal experience. So I have twin sisters younger than me, and one of them started struggling with mental health in high school. And
Mhm.
then it really kind of ramped up in college. And my parents had no clue what to do about
Mhm.
it. And
Mm.
to your point, Jad, yeah, it was like pray more, like I know some of these things can be spiritual, but they kind of wished it away versus like confronting it
Mm.
and wanting to be curious about how to help her. And it was fascinating, just like the people who were close to us, also seeing it as a behavioral issue because they're twins too, right? So they
Mm.
grew up in the same household. Like, why did one do this and
I
one
love
do that?
that.
And it's like
Right.
nobody thought of it as she needs help in the
Mhm.
way that was actually helpful. It was more condemnation, shame, not really getting the psychiatric help that she needed. So I can totally appreciate that. And, I'm thankful that she's at a point in her life where she understands that that's something that she really does, she struggles with, but she knows what to do and who to reach out to at the same time,
Yeah.
busy life. So making sure that she's making time for it is a whole nother thing too. Like all of us, it's a struggle. So that's one stigma, right? So if the outside is looking at you one way and the inside is looking at you
Mm-hmm.
that way,
Mhm.
where do you go then? And what
Mm.
do you
Yeah.
do? And where do you really feel safe? And then, it's just interesting with even things, I keep bringing ADHD up because I see it a lot, but also
Yeah.
Mhm.
because it is very stigmatized and it is fascinating to me. Fascinating.
Yeah.
People have their own experiences with medication, their own
Right.
experiences with drug abuse, and so they're very nervous about starting medication, understandably. And, the medications that they were on may have been first generation and maybe not second or third generation. So just thinking about like now we have extended release or now we have varying doses, right? Like we have smaller doses
Mhm.
that we can put kids on, not just one big dose that's just going to put them out. And so parents often say, like, I don't want my kid to be a zombie, or I struggled with drug abuse, so it makes me worry that they're going to be
Mm.
addicted. Or another thing is just like they don't want to accept it. Like they don't want their kid to be on medication for
Mm.
this, right? But I'm like, okay, so if your kid had a heart issue and needed medication, would you give it to them?
Mhm. It would be
Or if
okay
they
with
had
them.
diabetes or a thyroid or
Right.
whatever,
Yeah.
you wouldn't let them die as a result. And the crazy thing with it is the kids who really need it, who don't get it, years later, they're dropping out of school. And I'm not saying
Hmm.
this just from research because we know that to be true, right? We know
Yep.
that ADHD comes with comorbidities. We know that if it's not managed and treated well early, that it can get worse and it can
Hmm.
lead to dropout and other coping mechanisms that aren't healthy. So really trying to emphasize that with families. Sometimes it works, sometimes it really just takes them a long time to get there.
I know.
I just feel for the kids sometimes because even when you explain all the things, they still can't quite understand like this is a brain issue. This isn't
Mhm.
Hmm.
making the choice to disobey or not listen or not sit still. Like the impulsivity is just overriding everything. And when the impulse, or depending on what it is, sometimes it's impulsivity, sometimes it's just
Inattention.
inattention, right?
Mhm.
And then the combination of the two. But like whatever it is, they can't hold that information to apply that information. And then when they get home, they forget that, like it's just
Mhm.
a revolving,
Thought.
yeah.
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 So it can
And
be,
unfortunately, ADHD is one of those things that is still like in the middle of seeing it as a behavioral problem versus a brain
Mhm.
problem.
yeah.
And so, and I've had a lot of personal interest in ADHD. And
Mhm.
so one of the things that really struck me after talking with a few people and seeing presentations on things, including from one of my mentors, Napoleon Higgins, that, it just adds to, and another one, Sarah Vincent, by the way, it
Mhm.
just adds to this process of like the school to jail
Prison.
pipeline, school
Mhm.
prison
School to
pipeline
prison.
Mhm.
Yeah.
It's
is
still a
like,
reflection of that. Yeah.
yeah.
That is
And so,
so much. I was getting ready to make that point, Chad, but thank you. Thank you for
not
teeing
a
it up for me.
problem.
But
Not a problem.
yeah,
And
like, and
that's
not to cut
the
you off, so go ahead, but
No, no, and that's the struggle because, a lot of the things that may be perceived, for example, and I hate to put it in these like very broad, simplistic ways, but if you're seeing something in a white boy where it's like, he's yelling out, you see him, oh, he's spirited, but
exactly.
in the black kid, he's seen as
Ooh,
like
child.
disruptive
Ooh, child.
and a
Mhm.
problem in class. The white kid yells out and he's just excited versus the black kid, he doesn't listen and he needs more
Yeah.
discipline.
Or
And
it's
that's
aggressive.
come,
Like
yeah,
they didn't
and
mean
that
it.
comes
They
from,
didn't mean
right.
it like that.
It's fine. He's just full of energy.
Yeah.
And so that comes from within the school system and unfortunately even
Hmm.
within the home. And so
Hmm.
if those biases, getting back to our initial question, are already happening in both spheres, both
Hmm.
home and at school, it can be really hard for the child themselves to find a space where they don't stigmatize themselves.
Hmm.
Um,
Holy.
yeah, so it can be
Yeah.
very scary if we don't take these things sort of seriously and again it goes back to what I mentioned earlier and be really curious about what in this case a child is dealing with. But let me not dismiss the fact that ADHD 70 to 90% of the time continues into adulthood in some way, shape, or form.
Totally.
So, the adult may still need the help of therapy, medication, couples therapy, what have you, and are still gonna and could have those struggles instead of, doing poorly in school, they're doing poorly in the job. That instead of getting into arguments with teachers or getting in arguments with spouses, these things can continue on into adulthood, and that doesn't make them any less of a concern. Instead, we should be equally concerned and
Yes.
equally curious when we're having some things that we see as childhood problems still exist in
Yeah.
adulthood. So it's really
Absolutely.
about that curiosity all the way through
Hmm.
and really just being unashamed to be able to talk about these things because I guarantee, because I see it all the time, and I work mostly with adolescents who are saying, like, I'm having all these issues, whether it be depression, anxiety, ADHD symptoms, seeing things, hear things, suicidality, discomfort with aggression that like my parents and other people aren't really understanding, and I don't feel comfortable
Mm,
talking to them
mm,
about.
mm.
Yeah.
And it can get really, really scary imagining those same kids having these struggles when they're 20, 30,
Yeah.
50,
And
70.
raising someone else.
And yeah, and they haven't been able to really talk about these and express these things. So again, the taboo within, the taboo out,
Hmm.
it can really cause a lot of difficulty.
I was gonna say the taboo within the Black community with the spirituality or the religious perspective on this. I'm kind of like,
Yeah.
can we Jesus and therapy, or can we Yahweh and therapy? Like, can we do
It,
all of it? It doesn't have
totally,
to be one or the other. And I feel like
totally.
so often it's leaning in one specific direction, and it doesn't necessarily support the full entire situation that that individual is facing. So you can address it how you see fit within your spiritual identity, but you should also seek the supports to enhance the overall health of the individual to make sure that those things are in place, because it's very easy to want to see it. And I'm saying this as a person within the community who has experienced this within my own family and community. I
Yeah.
can say there's a desire to see it as something simple that we can pray away, or that we can, like, oh, if your relationship was different with God, or if you just chose to do something else,
Hmm.
versus
Mm.
having an understanding that there are other real serious situations that could be happening, even if you're not sure, that could be happening. And it would be so much better to get healthcare providers involved instead of just assuming that this is the sole solution.
Yeah.
uh, that's what's hard, I think, in what I've seen. And I know the culture we speak disappeared for a while. We were missing in action, but that was because I
Mm.
was overwhelmed. There were too many things going on, and I
Sure.
took a period of like, I don't care about that. We're not speaking no culture right now. We're gonna chill at
Yeah.
home, relax. I'm gonna bring it down because it became overwhelming. And so for my own mental health, I had to take a time away, and
Yep.
I didn't lose nothing over that. It is what it is. I had to take some time, but I think it's so important to be able to do that, to regroup, to seek some sort of understanding of where am I having this sort of overwhelming experience, or the difficulty I might be having. Is it just too much? Because I am the captain of team too much. So it could be that. But if it's not just that, then what else do I need to look into? And that gives you space to actually investigate your own system and understand what might be overloading you.
Yeah.
Totally. I think there's so many things that came out of what you said, Dee. I think sometimes if we're talking about spirituality and maybe primarily Western, Christianity, um, and Black Christianity too, you think of praying and being transformed. praying and being transformed. So there's this misconception that, well, if I pray and I'm transformed, then I don't really need any other help,
Mm.
except you can be transformed in your mindset of what you want your outcome to look like, but you may not have the tools to make it happen, right? And then some of the things that you were talking about too, Chad, about the trauma, we all know about the generational stuff that shows up in our life that has nothing to do with like
Mhm.
what it wasn't our experience,
Mhm.
but it's part of our DNA because that just happens, right? Trauma over time, unaddressed, it shows up in who we are as people. And so when we are confronted with this thing that is upon us, ailing us, causing us struggle, and we can't just pray it away. Like we're transformed and we acknowledge it. We're at the point where we can acknowledge it, but we still
Right.
don't have the skills and the knowledge to know. That's where I think you as your PhD doctor self and experience D, and you, Chad, in all of your experience as a psychiatrist, and me in my work, hopefully if we can make it all come together for them, that's where therapy can be the tool to help you build those strategies, build those tools, build that different approach. Because when you're doing the same thing over and over again, and it's leading to the outcome you don't want, we all know that that's considered a form of insanity,
Hmm.
right? So it's sometimes hard to make all those connections.
Yep.
Like, yes, the spiritual part is super important because now you have a space, a safe place to talk about it, pray about it, acknowledge it, and ask for strength to confront it and deal with it. And what are those strategies now? Because we can't just do the same
Mhm.
Yeah.
thing,
Agreed.
right?
Yeah.
Yeah. It's been an awesome discussion. We didn't even get to like half of these questions, and I love you guys because it doesn't require me to do a whole lot of heavy lifting. So thank you. What are some small but meaningful ways speech pathologists and educators can shift classroom or therapy culture to be more affirming for
Mhm.
students?
I think the first thing is just really the communication. And it has to be both ways. I know my experience, both as a clinician, as a parent, is that I'm the right one. Which is you're gonna fail miserably if that's your thought going into stuff. And I think that's got to be the same way with teachers too. Yes, there's things you know better than they, but you have to be open to the criticism. Like, okay, well, all right, well, I got that one wrong, let me come back and figure out what I need to do. So I think that's one. The second thing is just being really open to just general dialogue. Like I said, just really just general communicating about what's going on, being open to having those times that because kids get burnt out too. So being open to
Mhm.
talking about what's going on, because if they don't have a safe space to be able to communicate about stuff, then they're not going to feel like they're quote affirmed. And then thirdly, and this is something I have to do every day, is be open to learning. So when a kid tells you something and you didn't know, I mean, shoot, this whole 6, 7 thing, when someone tells you something like, what the heck are you
Right,
talking?
Yeah.
All right, well, looks like I'm going to do some Googling. And
right.
Yeah.
then you're like, oh, that's what that is. Okay, fine. And you decide how you want to work it. But at least you're open to the learning experience,
Yeah.
and then you'll come back. With kids, you have to always be open to learning. There's no way you can be stuck in 1977 and expect to
Mhm.
be able to continue with working with kids. So you have to be open to learning. So I would say those would be the three things: as being open to being criticized and being open to,
Mhm.
just, okay, I messed up. Let me check that. Be open to just communicating and just talking about what's going on, and just be open to that learning process. You're going to be learning just as much as they are, and you have to be ready for it.
I like that. I want to piggyback right quick on that. Do want to give, just 1977, excellent year if we were going to be fixated on one, but moving forward. No, one of the things that I do in therapy spaces for my kids when they are overwhelmed or when there's major stuff going on within the community or things like that is we may
Mhm.
have a session where it's not quite so structured. We sit down and we really talk about identifying different feelings or understanding what those
Yeah.
feelings are, and then the language around maybe addressing and discussing and processing whatever may have occurred. And that can be a very valuable session, even
Hmm.
though it doesn't speak directly to maybe the way they produce a certain sound or the specific goal on their IEP page. It does enable them to access the activities and the work that we do need to do in order to be in keeping with that IEP. And so sometimes you just need to turn off the lights and relax for a minute and talk about the big emotions
Mhm.
that are going on or the big feelings that are happening, and understand that without that language, the children aren't going to be able to process. They're not going to be able to get
Mhm.
through this, and they can't seek help. And so this whole time we've been talking about going and finding help or talking to trusted adults or trusted people. You can't do that if you don't have the language around that. And so that's where the
Mhm.
work that we do is so important. And I want to make sure that speech therapists are not overlooking the fact that that is a big piece of the work we're doing. That is a huge component, because
Yeah.
without the ability to communicate their emotions, their experience, then they're not going to be able to effectively get that support that they need. So
Yeah.
that's so important.
I was thinking that also kind of goes into that question that you were asking about what impact does linguicism potentially have on mental health? I agree with Chad too. You have to be curious in order to want to learn. And not every kid that I have is going to, I can't use the same strategies for every kid, right? Like I'm gonna have to
Mm-hmm.
really meet people where they are, and that can be challenging, right? Depending on kind of what's going on for the family, what's going on for me that day, it can be challenging. And I think what I thought about is what makes the kid feel valuable. Because you were
Mm-hmm.
asking, like, if they're
Mhm.
constantly corrected, what kind of impact does that have on them? And I even struggle with that with my own kids,
Mm-hmm.
like constantly correcting them as opposed to like, hey, is there something else we could do differently here? Is there another way that you want to say that? What do you
Mm-hmm.
think we need to do? And like it's really hard when you, again, working a lot, trying to just get from thing to thing, got to get to soccer practice, got to try to get there, make it on time. There's traffic, and you're just trying to like make it all happen in the way that you kind of want it to look like. And I think I have to remind myself often, like, and I need to work on this. I really do. But as a parent, just Holy Spirit just convicted me there. But the thing is, that's also a privilege a little bit too, to be able to slow down and think about certain things and
Okay.
reflect on certain things, but making it more of a practice of, okay, like I need to take out what I think this day is going to look like,
Mm.
right? And what I expect it to look like and what and not to say that we can't manifest things. I think that's really
Mm-hmm.
important, but it may not always manifest. It can manifest, but it may not be the what I think needs to happen in order to make it manifest. So I think that's really
Mhm.
important as a clinician. Like I may want a certain outcome for a patient and they may not want that outcome. And I have to be okay with that, right?
Mm-hmm.
Yeah.
But supporting them, what do you want? How can I help you? And sometimes they don't want it now, but knowing that you're on their team,
Mm.
eventually they may get there if that's
Yeah.
the best thing for them. So that could be sometimes just something to think about too.
Yeah. One thing I always keep in mind too is for kids, we tend to talk a lot of negatives, like what's wrong and what needs to be changed. And I think you kind of commented on it. We have to kind of be on their side a little bit, and we have
Mm-hmm.
to talk about the positives and things that they can do. Like I commonly quote this level of research that came out, I think in like the 90s. Dr. Jelinek commented that by the time a kid with ADHD turns 10, they have dealt with 20,000 corrective statements.
Mm,
Wow.
mm, mm.
And when I read that, I was like, yo. And I just
Yeah.
think about that, shoot, with my own kid. Like, oh my
Yeah.
God. Like, I'm just thinking
Yeah.
about like all the times I've said, like, sit down, don't do that, go over there. Like, how it can add up to 20,000. And so that can
Yeah.
make a kid really just feel uncomfortable
Yeah.
being in any
Mm-hmm.
space if they're always feel like everywhere they are, they're getting corrected or some negative statement. So definitely trying to look for the opportunities to support them, say, yes, you did something right.
Yeah.
And, and we want to support you in kind of doing those positive things.
Yeah,
Yeah.
and finding the strengths is so important. Please include those in reports. I get a lot of speech pathology reports where it's just like, oh, they can't do this, they can't
Yep.
do that. And when, it's just all the things that didn't happen. It's a laundry list of all the things they weren't able to do,
Hmm.
Hmm.
rather than, hey, here are some things that they were successful at, and here are some ways that I was able to support whatever we were working on, or this is,
Yeah.
the strength the kid brought to the
Yeah.
the session. Chad, I know you have to hop off soon, but I wanted to thank you for bringing such thoughtful insight into the conversation. Before you go, what's one message you want listeners to take away about protecting their mental health in today's world?
First, before I go, I do have to thank some people. I got to thank the people who pay me, Sheppard Pratt. I got to thank the people who educated me. That's University of Maryland and Howard University, HU. And I got to thank those people who support me. That's my wife, Joy, my little 5-year-old, and of course, my family. Um, I think my final words are kind of touching base with what I said earlier. It's really important to approach everyone who you're working with, everyone you care for, and everyone you want to connect to with curiosity. Yeah.
Thank you so much for taking the time to be here. We appreciate you. And, I know we're sort of in community, so I
Yes.
appreciate you
Adjacent.
and the opportunity to like bounce ideas off of you and those
Of
sorts of
course.
things. So thank you.
Glad
for
to be
being
of
here.
help.
Thank you for tuning in to this crucial conversation. There were important dimensions we didn't get to fully unpack here. In the next episode, Dr. Enyo Dzata and I continue the conversation, going deeper into Black mental health and the current socio-political context. Be sure to tune in for that continuation here on The Culture We Speak.